Friends, today I would like to talk about COVID-19 vaccine. Why should you get vaccinated? This has been a most common question asked by my patients, my friends, my family. This is a couple of points to make you convinced that why the vaccination is important. So as you have seen, this vaccination have started. It's already been given for around 2-3 billion people, and some of the people had side effects, and I'll get to that part. First of all, why it is so important to have the vaccination. So after getting COVID, I've seen a lot of people talking about long haulers. That is, like, people live with COVID-19 symptoms, like lungs are getting suffocated, they are using inhalers, there's clots in the legs, there's stroke symptoms, there's so many issues. So many of my patients are also complaining about why this is because of the cytokine storm. This has been affecting very badly to the patient's internal organs. So do you want to live with that issues long term? So that is one question to everybody. If you ever get COVID vaccine, do you want to live with that, all those symptoms? So if you take the vaccination, the risk is actually much lesser. The risk is much lesser because you're not going to get COVID, at least 95% to 93% effective, most of the vaccination which is out in the market. So there are two kinds of vaccination. So why I am explaining this to you is, like, the questions people ask is like, why this vaccination is being not studied enough. No, this vaccination or the technology which is used being studied almost 2 decades, and this has been used to develop like a Zika virus, influenza virus. But why it was not only fully completed? Because of the funding. So this time, why the government has funded about 1.7 billion to come out with the virus vaccination? Because the economy is down, so many things are affected all over the world. So that is why this technology was already in the market but was not used extensively because of the funding. So second thing is, like, people who think about the vaccine is mRNA vaccination. What do you mean by mRNA vaccination? That's called messenger RNA. What has it done is, like, they have taken genetically modified a protein from the virus and they have embedded it in a lipid layer and have been injected into the people's, like, into the vaccination site. And what happens is, it goes and actually don't even touch the nucleus. It actually produces the antibodies in person's body. So that is the difference. Most of the other vaccinations are live attenuated vaccination. That means a live virus is cultivated and actually been used different mediums and been used. So people are doubting about all these things. There's a lot of questions every day, but it's definitely to understand one thing. This is not going to harm your nucleus or any of your cell. It is making the spike protein outside the cell, and once the virus is being in, on your body or anything, the spike proteins are sensing it and actually producing antibodies to it. Second thing is, what are the two injections available? That Pfizer has one, Moderna has one. People are asking, should I take Pfizer or take Moderna? Pfizer is actually 95% effective. Moderna is 94% effective. Both are studied in over 30,000 people, and it is being actually recommended to people because it has already been studied and given to people and proven that it is effective. And the risk is much lower when compared to all the other issues, because when you get COVID, this is what happening. So people think that if it is not for me, make sure that you guys go and get it done. And who should be taking it? Everybody should be taking it except children, which is not being studied. Lately it is being, actually they've been studying it. Second is pregnant women. There is more risk on it, so that is the reason why it is not being recommended. Over 18 years old, anybody could get this vaccination, especially those who are in the healthcare work. Please make sure that take it, because every day, every moment is a risk for you. So please make sure that you take the vaccination and protect yourself against COVID. Ms. W, I know that you said that you had COVID. So do you want to share me your experience for having COVID and what were the problems and what were the issues which you are facing now?
I have. This is my 24th day. I've been out of work. My 24th day since my first symptom. My first symptom was a little tickle in my throat. And the next day, it was just sinus. I was really plugged up. I called off work They suggest I get a COVID test. I did, and it was positive. I was very surprised. It was only symptoms in my sinus, and it just kind of went downhill from there. I started with a cough, shortness of breath. I did that for about a week, and my doctor finally put me on antibiotics. A mucus relief pill that took a few days, and it did start to bring up phlegm. And still, I am just have a slight lingering cough on the 24th day, and I'm very lightheaded when I try to do anything. I'm dizzy. I get overheated. I sweat. But the short.
Okay, what are the long-term symptoms you're getting right now? Because I know that you said that you're feeling shortness of breath. Would you explain it to me?
My shortness of breath is I can just be sitting in the chair, just watching TV, relaxing, and it just gets like I can't catch my breath. And that happens 20 times throughout the day. You know, I really have to work on getting a breath. I use the inhaler. I try not to use the inhaler over what I'm supposed to, because that can cause other effects. I do have a continuous headache. That headache is still, I had that at the beginning, and now it's come back, and it just is lingering. The shortness of breath is the most thing that is scary to me.
Okay. What is your opinion about vaccination and COVID?
Vaccination, I'm waiting. Now I have to wait another 90 days until I can get my vaccination. And I would absolutely recommend getting a vaccination. I'm on my countdown.
Yeah.
I'm not quite, I'm supposed to go back to work in 2 days. Tomorrow I'll call my doctor and see where I'm at. So it's going to be 90 days from where I don't have symptoms for 3 days. There's a few people in my family that have been vaccinated. They had a little soreness in their arm. My sister felt a little queasy for a day. Other than that, everything went well.
All right. Thank you so much for your feedback.
You're welcome.
Thank you.
You're welcome.
Doctor, today I have some questions about COVID-19 vaccination. I know you took 2 vaccinations. Your second dose is also done. So can you just, in your opinion, what is something about the vaccination and what vaccination you took? So what is the vaccination you took? Pfizer or Moderna?
I took the Pfizer vaccine, and the first dose was on the 8th of January, and the second was on the 29th. And I feel it's pretty safe, and we are on the front line, and we have to see patients, even if we are cutting down to televisits 50% of the time and in person, but we still need to have some kind of patient encounter. So that's why it's very important. I feel safer now taking care of my patients. We still take all the precautions that are necessary for everyone else. Like we wear the mask, we maintain social distancing, and I feel better now that the vaccines are available for us.
Okay. So what side effects did you experience, or did you experience any side effects?
So when I had my first vaccine, the only side effect that I had was the soreness in the arm and a little bit of neck and upper body stiffness, which was not severe. It was mild enough that I could continue working that day in the office. And when I went back home after dinner, I went to sleep, and the next morning woke up like nothing ever happened.
Okay. After second dose, what was your experience?
So the second dose was phenomenal in the sense that it caused absolutely no side effects. I did not even, except for the initial prick when the vaccine was when it was inoculated, I had no side effects, no body aches, fever, chills that some people are talking about, or soreness either. So I didn't even have soreness in the arm. The next day, I felt a little bit of minor soreness on deep palpation or touching the area, but really, it was nothing.
Okay. What is your recommendation to everybody? Do people should take the vaccine?
I highly recommend it. Again, you have to discuss with your doctor if you have any condition, but I highly recommend it. And also, I highly recommend my family to get it. Some of them are on the list, and they're waiting for their turn.
Thank you so much, doctor.
You're welcome.
Hello, Ms. J. This is in regards to my vaccination feedback. I wanted to ask you one question. What is your experience about vaccination, and what vaccine did you take?
I got the Moderna vaccine, and then I was doing okay. Later on the day when I got the vaccine, I just was feeling a little bit dizziness. That was it. The second day I had headaches, and then after that I've been completely fine, no effects or anything like that. I've been doing good. My second dosage is on February 19th. Other than that, I've been doing great.
How your arm was sore?
A little bit.
Okay. So the second vaccination is in 28 days. So Moderna vaccination is in 28 days. So one question is like, what do you think about the vaccination? People should take it or people should not take it?
No, I recommend people taking it, because a lot of people who are asthmatics and who have those issues are, like who smokes, and, so much out there that people, I think, should take it, because me and my family had COVID first, when it started. And then every day the things me and my kids went through, it was very rough. So I definitely recommend it to everyone. Please take the vaccine.
Thank you.
Thank you.
How are you?
Fine.
I just wanted to check with you. You said you took your first vaccination.
Yep.
What is your opinion about it?
Well, we didn't have too bad of a reaction. My husband had no reaction. I was tired, and our body's achy anyway, so I don't know if it was that or what. But
Any
was
sore
achy.
arm?
A little bit, but
Okay.
not bad.
Okay.
Not bad at all.
You took the Pfizer vaccination.
Yes.
And when is your next vaccination?
The 17th at 3 o'clock in the afternoon.
What should people do? Because I'm getting a lot of questions about should I take it? I'm not taking it. What do you think?
I think they should take it.
Okay.
If we want this to go away.
Okay. All right.
It's you might get sick. My granddaughter is a doctor. She's a PA. She got it. She got really sick.
Mm-hmm.
But she recovered, and
Okay.
she's fine.
Okay.
And she's a PA. She works in neurology, and she said she was very sick. She had to take a day off from work. She ached so bad, like her legs were going to give out on her. But we had no reaction like that, and we're
Good.
82 and 84.
Yeah. Good. Thank you so much.
Yeah.
Hi, I took Moderna vaccination 2 weeks before, and the day one, actually, I had a slight bit of sore arm. The second day, I had severe headache. Other than that, I didn't have any much side effects. I actually was pretty much happy that I got the vaccination, and I recommend to everybody.